We live in an era of mRNA vaccines and robotic surgery, yet some of our oldest biological adversaries are currently winning a global war. These pathogens breach human cellular barriers without triggering an immediate alarm response, establishing themselves before the body recognizes a threat. This chart tracks a continuous rise in sexually transmitted infections, excluding HIV, over the last decade. In a single recent year, the World Health Organization recorded over 1.1 billion cases. The primary weapon driving these numbers is a prolonged stealth phase. These pathogens can reside in a host and replicate for months or even years, while presenting zero initial symptoms. The catch-all abbreviation we use to describe them masks the diversity of the biological threat. We are actually dealing with three distinct entities: bacteria, viruses, and parasites. Because these three groups function under different biological rules, a generic approach cannot stop them all. Controlling this surge requires a strategy tailored to the specific survival mechanisms of each invader. We begin with bacteria, the organisms responsible for chlamydia and syphilis. These are living, autonomous life forms, which allows us to target them with antibiotics to cure an infection. But bacteria reproduce rapidly, and with that speed comes the ability to mutate. Through antimicrobial resistance, these organisms are learning to survive the drugs designed to kill them. This chart tracks antibiotic failure rates against gonorrhea. 35% of isolates now resist quinolones, and 28% resist tetracyclines. As these cures fail, medicine relies on a single antibiotic, ceftriaxone, the only stable baseline here. This is an evolutionary arms race. We are no longer just treating infections. We are trying to outpace pathogens that are learning to outsmart our chemistry. We see this adaptability in the resurgence of syphilis. The infection is caused by Treponema pallidum, identifiable by this tightly coiled spiral structure. If the initial infection is not stopped, the bacteria eventually breach the blood-brain barrier. Over time, they physically invade the central nervous system, leading to neurosyphilis. Physicians refer to it as the great mimicker because once it reaches the brain, the symptoms look exactly like unrelated psychiatric or neuro-ophthalmic disorders. To catch it before it hides in the nervous system, clinicians are moving toward automated treponemal blood assays and precise testing of the cerebrospinal fluid to find the pathogen's genetic footprint. When bacteria bypass standard immune defenses to hide in the brain, diagnostics must become equally invasive to track them down. Viruses operate under a different set of rules. Pathogens like HIV, HSV, and HPV are packets of genetic material. As seen here with HIV particles, they attach to human cells and integrate into the host DNA. Since they become part of the cell, antibiotics cannot kill them. The persistence of these infections shifted the medical focus toward lifelong management protocols, creating a system built around containing the threat rather than eliminating it. Effective management now requires hyper-specific identification. Clinicians must distinguish between exact subtypes of the herpes simplex virus to suppress its replication and prevent transmission. The most effective countermeasure is stopping the virus before it integrates. The HPV vaccine trains the immune system to destroy the virus upon entry, blocking an infection that can eventually cause cervical cancer. The third category consists of physical hijackers, like parasites and fungi. Trichomoniasis, for instance, requires targeted anti-parasitic therapies that differ entirely from viral or bacterial treatments. If medical science cannot extract a viral sequence from human DNA, our only options are lifelong suppression or absolute prevention. For decades, sexual health clinics operated on a reactive model. Doctors often distributed broad-spectrum antibiotics at this penicillin table based on symptoms alone before laboratory results could identify the specific pathogen. That model is being replaced by on-the-spot diagnostics. Clinics are deploying point-of-care testing that identifies specific pathogen DNA in minutes, alongside new at-home rapid diagnostic kits. This immediate data provides a specific tactical advantage. By cutting the wait time for results from days down to minutes, clinicians can interrupt transmission chains before the pathogen moves to a new host. Modern strategies now prioritize extragenital testing to detect infections in the throat and rectum, alongside expedited partner therapy, which allows patients to provide treatment directly to their partners without a separate clinic visit. As pathogens adapt to our drugs and hide within ourselves, we can no longer wait for symptoms to appear. The future of sexual health depends on illuminating the stealth phase through immediate, proactive detection.